Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. It is my immense pleasure and honor to present to you guys in the Research Loading Dose platform for SCAPE, Saudi Critical Care Pharmacy Research. My name is Mohammad Shawaqfeh. I am an Associate Professor at College of Pharmacy, King Saud bin Abdulaziz University for Health Science. My topic title is Mastering the Art of Brainstorming Research Ideas. The outline of my talk, it's going to be a little different and unusual, but I try to be as much as organized. Discuss brainstorming techniques toward formulating a research question. I'm going to go over the ones that I am familiar with, and I will give you a quick glance some other techniques that we might present. Formulate a logical, useful, and searchable research question, because if I show you how to do it, I want to show you the example how we're gonna do it. First principle, let's agree, we must admit as researchers that either we don't know, or we're not really sure, or we need more evidence. So if you check none of these, so I don't think you should continue in this talk. So brainstorming. So let's go into the topic itself directly. It is actually a well-known term that describe a group problem-solving method that involves spontaneous contribution of creative ideas and solution. This is easy to tell, but this technique really requires intensive discussion in which every member of a group, so if we are a group of researchers, everyone has his input and is encouraged to think aloud and suggest as many ideas as possible based on their diverse knowledge. Of course, there will be expert, there will be novice, there will be naive, there will be new people. So it's okay. Let everybody say their take in this research idea. Brainstorming actually sometimes understood as the conventional group problem solving, because this is what we call group think. So if we are in a group and we start talking to each other, we will be intimidated by the most experienced, the people who knows, and we will be shy from saying out loud what we're going to say. So this is the reason why we're talking about brainstorming in a different way, non-conventional way. Individual brainstorming, and this may be a surprise, can produce better ideas than group brainstorming. Brainstorming, the people who are loud, who are proactive, who has experience, they will usually take the stage. The people who are silent, they might have ideas. So this is where brainstorming can be something important. So brainstorming is a process, and you're gonna see like a lot of slides that gonna talk about brainstorming used in so many different disciplines. Usually brainstorming as a process, I find this neat slide. Set a time limit. So we, for example, will agree to meet as a group for half an hour. Target a problem or a goal. So we will be specific what we're going to discuss. So for example, today we're going to talk about implementation of pharmacogenetic testing in clinical practice. Very important. Everybody is safe. You can say anything you want. There will be no judgment or criticism. At this time point, nobody gonna tell you, oh, this is a good idea, or nobody gonna tell you, oh, this is not gonna work right away. Even if they know, and they know that it is not. Just this is a time for listening. It's called brainstorming. Just get out your ideas from your brain. And you should, as a leader of the group, you should encourage all ideas. You never know. It might be something good. It might be something, because with the assumption that we say either we don't know, or we want to know more, or we want to look at the things in different way. And there will be an aim for quantity. So we want as much ideas as we could. Then it will be filtered out later. It's fine. Don't get scared of that. Everybody gonna tell something. They have different experience, so they might be the way to go. And start building on ideas. Here, it's more of not a controlling, or it will be a revision and a discussion. I will ask every single one, why you suggest this? Why you are assuming that this not gonna work? Why you are not so optimistic? Why you don't think this might work? Why you are thinking that this gonna work? Also, the people who are optimistic or pessimistic, we're gonna ask them the same question and try to be visual. Like this is really make things connect with other people with easier way. Like if you put an idea, you are shy to say it. If you write it and you put in a sticky note and you go put it in the board and everybody's seeing, this might encourage people to get out of their comfort zone and they're gonna, because nobody anonymous, everybody write an idea and stick it in the wall and everybody come and look at it and allow one conversation at a time. Brainstorming, the word like storm, it can indicate something or implicate something that, oh, there will be a fight. No, this is usually happen in logical way that everybody will get his own turn the same time. For example, everybody will go around table, everybody say his viewpoint and how to go with this problem. Why brainstorming? Usually, you may be also surprised with this. We end up in a major case of writer's block when tackling a huge project. Even the people who are living all their life in research and they're doing so many different research, they will reach a point that they will get, oh, so what next? What should I do? Where I'm gonna go from here? So this is the right time to get into brainstorming and get ideas from other people. When you are feeling overwhelmed, although I don't use this word all the time, with your research, use this process to regain your senses. It is like regeneration. You can start, instead of telling people what to do, start like to listen to people what they want to do. Maybe through their short experience, different experience, their perspective. People read, people see, people watch. So they're gonna bring you different things, and you're gonna find your senses regenerated again. And usually, it's not this typical. You can do it as much as you want, as for long as you want. But the brainstorming session usually 30 to 45 minutes, not more than that, and allows to jot down the bigger picture. So you're gonna see everybody in the team what's their take in this project. Brainstorming usually help build team working skills. How is that possible? So if you ask everybody, what do you think about my project, clinical implementation? So everybody come with a different idea. So you start seeing like some people are having ideas of like literature search, seeing the different research steps. So these are the people you want to team them up in this. Some people they want to go to the design part. Some people they want to go to the analysis part, interpretation part. So you start seeing that the people, if say imagine that you have like 10, 15 people in your room. So you're going to divide, for example, into groups of threes. So you're going to have 5 different teams with similar interests, not exact same, but it will be like you're going to find your team easily made up. Uh, Encouraged to think out of the box. You have no pressure. You can think of whatever you want. You can come up with, oh, I want to do a clinical study. Somebody beside you say, oh, no, 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 let's do retrospective. Somebody say, let's do a case report. Somebody will say, oh, how about just focusing on the people with cancer, because this is like really pharmacogenetic of cancer is the most applicable. So you start seeing people giving you ideas that it's not in your area of interest, or it was not your very basic question that you ask, brings to light new information that may have been overlooked. For example, you can start with, oh, I read a paper, I see a paper, somebody did, I know a group, I talk to somebody, I meet with so and so, and it can be like very simple thing, and you can actually infuse like the direction of the research that you want into the brainstorming group, and they start, oh yeah, he mentioned that, what about the cost, where are we going to do this, do we have machines, are we going to do PCR, do we have the logistics, do we have the personnel, do we have the money? So when you start doing this, means you are really starting your brain. So what are you waiting for? Brainstorming is the step that you are free to do whatever you want, say whatever you want, state whatever you want, whether we agree on that or not, but this is your time. In steps, it's very easy. Like, I'm gonna tell you some things like really very simple, like 101 brainstorming. You can start with step one, draw a circle in the middle of your subject written in it. So, clinical implementation of pharmacogenetic testing. Oh, that's a lot of words. How about start with clinical pharmacogenetics? This is two words. Yeah, that can be like, yeah, I wanted clinical, I want pharmacogenetics. So you can then surround it with the categories of information that you have uncovered in your research process. Okay, so what is that? So you start branching from that. What population, where I'm going to do it, is this study design that I want, do I have the logistics, do I have the money? So this is where you start putting the big picture, and we call this mind mapping. You put everything in so many different people brains into one stage. And this is an example of mind map, a brainstorming tool about global warming. This is something like really not, although I have some interest in, actually, we're submitting a proposal for environmental health. It's about antibiotics and drinking water. So it's not really far from my specialty, but this is an example. So global warming, so you start people talk about this right away. When you mention global warming, some people will start thinking of environment. Oh, rising sea levels, destruction of sea levels, air pollution. And this is the very first thing. Maybe somebody interested in geographical. Oh, it's in developing countries and I can't say it, like the North Pole. Or economic. Is it affecting culture? Is there any corporate rules? Human factors, reduce use of fossil fuels, impact on the world health, the political Kyoto Protocol in Japan, role of government. You have different people. Everybody has different background. So everybody will start talking about a different way. And this is not something like encarved in stone. You can do it in so many different ways. If you can want to start the global warming with what you know, you might know one arm of this. But this is the idea of brainstorming. Everybody putting his experience, his background. Step two, by developing at least one subcategory for each category, your thoughts can flow and can grow your brainstorming. So start from clinical pharmacogenetics, then start to pharmacogenetic testing of certain enzyme. Then somebody will go, oh, I will do PCR. Some people will go, oh, I will do mRNA expression. Somebody will go, oh, how about doing this in transplant only? So you start like opening and expanding. This is like very simple cartoon. Main topic, argument one, argument two, argument three. So what's the arguments that you might come with? Because you have to have a question. I'm saying clinical implementation pharmacogenetic testing. So what? Argument one, it is beneficial. Argument two, it is maybe beneficial, but it is not really evident. Argument three, it is a waste of time, it's a waste of money. Then you have now three groups that debating about what's gonna happen. So everybody will come out. Oh, the first one. Oh yeah, why? Oh, there is evidence in the anticoagulation with warfarin and stuff like that. So this is come up with some evidence. Argument two. Oh yeah, there is a lot of published research in certain areas. For example, in psychiatric medication, it's not really helping. Argument three, oh, it is like really a waste of time, waste of resources, adding another panel of experiments and tests for the patient, and it's not going to help, and it's very costly. So you're going to find a lot of different thoughts, and that's healthy. You can have all arguments together, and you can build your theory. What if? And you can actually build your hypothesis of supporting your argument one or argument two or argument three. If you know at this time point of brainstorming, your main topic is going to be argument one, quit. This is not, this topic is, you already know the result, so you don't need to do it. I met with somebody in ICU before, and he told me about like fluids use. I asked him about, are you guys using plasma light? He said, oh no, we don't have that. So I was like surprised. So because the place I work in the United States, they use it a lot. So I was thinking we might have it. So when I investigate, I find out that they don't use it. So like my whole theory was done at that certain time point. Like, why am I investigating something that nobody interested in using? Techniques, there is a lot. Like I will be like not honest if I told you that there is only six, but these are the very common six like techniques used for brainstorming. They're very simple, and I'm gonna describe to you. We use in course that we pharmacy management and economics. We do like workshop style interactive session, and I use these like kind of techniques for brainstorming to come out with ideas. But at the research level, we can use actually the three that I bolded. These, like, I have been part of these. The others, honestly, I did not do, and I'm not really much familiar with that. But in research, mind mapping, rule storming, group ideation are common one. I will not spend too much time on these, but I will give you very simple. Mind mapping, it is usually, as I mentioned, it's very good for the visual learners. You know, when you teach people, some people they learn from listening, some people they learn from giving them handouts, some people they self-study. One of the best, very effective teaching ways or communicating ways is the visual learning. Means you use tools that show people stuff. So if we start with an idea and you have different topics, topic one, two, three, four, and in each topic you have subcategories as we mentioned. We call this mind map. And this usually is not one person idea. Topic one is not belonging to one person. So we collect all the ideas that fit into topic one, and we put also subcategories that following topic one, and we do the same for topic two, topic three, topic four. Of course, I put like three, two, because this is not homogeneous. It can be like topic one has so many different things, topic two has one, two, topic three, topic four, and you can have as much topics as you want. But we'll talk about this later. So mind mapping is you outflow all your ideas from your group brains into a map, and you just put it there and you start jogging out the things that you think it's not visible, it's not doable, it's not important, it's not necessary, and so on and so forth. But this will be like very good, like to create a memorable mind map, and it appeal to your senses, visual appealing, and usually they stick into the mind. When I see a picture, I will remember it. Sometimes, you know, if you exaggerate in mind map, you make it confusing, and it can create absurd images. So you don't want that. So just be careful in that. Usually you can use actually lines, and you can use curved lines. And the people don't really like the typical type of this, the nice, neat picture that I put. So you might use images, you might handwriting, the same one that I show to you. And usually this is really a fun exercise that we do all the time. You can use different colors. You can use, you know, research life and little rigid, and you're talking about patient, about life and death. You can have a little bit of fun. It's not going to be boring, and it will be serving a creativity. Role storming, this is similar to that, but in a little bit different way. As you see, I put a puzzle in the middle of the table, and we have a round table, so there is no boss on this table. So what we do, we distribute roles of the research, okay, into different people. Like, for example, you study design, you literature search, you statistical analysis, you discussion. So, like when we write a paper, so we use this mostly in when we write a project together. So the writing of the proposal is part of the process. So if you want to do this, So we let everybody in his assumed rule give us an idea. Then round two, we change the rules. So the leader is not no more the leader. The one who's in the writing the aims is not, the one who's in the methodology is not. So everybody will do that one, and we keep doing rolling this as much as you want. Two, three, four, five. But usually the dangerous in this if we have so many different people with so many different levels of experience. So if we have a project that, for example, Dr. Khalid is leading, so nobody gonna step into the leadership position because he's the leader. But you can have sub leaders, like that they can give leadership ideas or management functions that might let him think again about doing this. But usually, as I told you, this role storming, usually you have to have like the group almost all like same level or close by level uh, of education. So it is really a group learning technique, and it will encourage individuals now to gather ideas from different persons' perspective. It is similar to that, but here you are seeing what the other people think about that point, and you start modifying or you start changing, you start uh, so you are putting your idea, but you're like a cheat sheet, and it is limited by time. So it is also fun. Like when we give, like for example, 5 minutes each round. At the end of the 5 minutes, move. So you move your role to different person, and you don't know like the assignment. So you don't know your next assignment. So this is also a good one. So when you switch characters, you might actually come with a different idea, or you might realize, oh, I'm wrong. So this is really nice because everybody will see what everybody else is thinking without knowing who. So this is a different, like it's a play, like role play brainstorming. Group ideation, I use this in my course actually a lot. It is really I'm not going to say unique, but it is really engaging a lot of people in the project. They come together to start brainstorming ideas, start having one person in the group, start the conversation with what the topic is needed. For example, what color should we choose for our company logo? Then go around the room and let everyone have an opinion in what they think. There is no wrong answer. Nobody can say, oh yeah, the queso is green and yellow. That's not. The point of this is to see the different angles and the different opinions that others may have. And always be sure to write down all the different ideas that come to everyone's, so that you can refer back to them and you may ask them if you need. And usually this not taking it, and people will feel like really because it's anonymous. You just have a sticky note, you go to the wall and you stick it, and nobody knows which ideas is that. So it turns it's not good, it's okay. If it turns it's great, you're not gonna get any like thank you letter or something like that. It is a group ideation. It is the idea of the whole group. Sorry. So the other things that or the other brainstorming techniques that I mentioned, like time travel brainstorming. This is like really talking about something. If you are gonna expect something in the future, there is like I forget what was the other one. Uh, Let me just brainstorming. I have cheat sheets here. Uh, yeah, reverse thinking. You start with the end point. You start, okay, so if what if we get this? So you go back, you start like thinking of what should I do so I don't end up. Also, this is good like in the business things, so they know like if things fail or they lose or things doesn't go right. For example, we start the clinical study, we want to recruit. What if we don't recruit people? What if we don't get the grant? What if we don't have the, like we rely on the K mark for the analysis and the K mark did not give us? So usually these are the things that we usually, you can use a mix of them. There's, as I mentioned, there's no like one right thing to do. So let's move from brainstorming as we have all these ideas. What are we going to do with all this information? I'm already a researcher that is overwhelmed with so many different projects and stuff. No, now it's not overwhelmed. You have a bank of ideas, but need little trimming, organization, cleaning. So the best research question. So you start with a broad topic and you want to go to a specific question. So you want to trim this. So you're going to have rules how to do this. So you start with the topic. The topic is clinical pharmacogenetic testing. This is like really our implementation. This is big thing. So in order to narrow that topic to like a workable focused question, uh, working knowledge of the topic narrowed down through preliminary research. So you start looking what other people do. Did anybody publish this? Did anybody do the same idea that I did? Should I reinvent the wheel? Is there any innovation in this? Am I doing it in a different way? Or it is a replicate of others? The more you are unique, you more innovative, and I will give you the criteria toward the end. You're gonna have like possibility or probability of success much higher than if you are doing something that everybody is doing or similar to them. For example, we're working in a line that medication error reporting. So, like this is a part of the pharmacist's job. So what we're doing, we're collecting the errors and we classifying them and we say this. But this is like for learning purposes, for teaching purposes. The student will go collect data, they identify them, they do statistical analysis, it's fine. But for me, if I get this and I want to publish this, I will find like it really difficult to publish because it is lacking a very integral part of it is like what question that you don't answer. You are replicating the other people. So you can come up with working a question, and I'm gonna uh, like explain these two terms, problematization and gap spotting. And then of course we working with expert people, like people who has experience. So these people also they are the one who's going to decide is this a question work or not work. It's not democratic or somebody gonna come and say like, oh, let's vote on this or vote on that. No, there will be like logic behind all these steps. And then we're going to come out with research question after we evaluating all these ideas. So what is the research question before I go into the more complicated thing? It can be an issue or a problem. It can be a phenomena actually. It doesn't need to be like a problem, but usually people will look for problems for solution. I'm not going to go for things that are running really smooth and everything is fine and what I'm going to look for. And through analysis and interpretation of data will answer in the study conclusion. If you have a question that you don't provide an answer after all this effort, brainstorming, research question, research, data collection, and you don't know what to answer, what's the answer? Because you don't have a solid hypothesis that the data will provide, or you're going to get up in the dead end with no answer. So the research question has to be a question that has an answer. You don't know the answer, of course, you should not know, but it has to has an answer. But I'm giving you good news about that. Sound rigid, but it is a dynamic process. Means the researcher can change. And a lot of people they think, no, I will stick to the IRB. No, if you find out this is not something that you're looking for, or it's going to the wrong direction of your hypothesis, you can change your question and you can come up with a new idea. And sometimes you can just working on something and you find somebody else is doing that. And this is happening in real life. And you can look at the literature, you can start actually looking at the people. Yeah, oh, you do this, and this is what you end up with as results, because we are like going into that direction. Oh, you don't need to do that. Probably this is like very likely will turn you off from continuing in that project if somebody else is doing it. And this is very common. So a question that is need an answer from the data collected, and when it's interpreted and analyzed and you come out with a conclusion, is a dynamic process. It is not rigid. And it can be, this is a mistake that I see a lot of researchers go into and they get stuck. You have a single research question. If you do, if there is like logistics, like money, fund, stuff like that, it's fine. Focus the question, single question, it's okay. But usually the elegant research and the big research and the research that it usually can handle more than one question. This is the reason we have primary aim and then we have secondary objectives, then we have, so you can don't refrain from having multiple questions to be answered from the same research. Why it's important for the research question to be focused? Because it narrows down a broad topic of interest into a specific area of the study. Instead of saying clinical implementation of pharmacogenetic testing, I will say with anticoagulant in ambulatory care. See how I narrow that with two words. So now everybody thinking, yeah, clinical implementation of pharmacogenetic testing in with anticoagulants in ambulatory care. So I define my population, I define my medication, I define my main problem. And you can be more specific even. Research questions serve as a guiding framework for research. You can't be just go there, oh yeah, I read something in the Google or Google Scholar or a paper, or I see something somebody share in LinkedIn, oh this is a good idea, let's do it. That's not how it works. You should, they come together, like it's like a magnet. Research question will collect together and come up with one question that is focused. And also, these questions usually reveal the boundaries of the study and setting the limits. This is very interesting. Why? Because when you put a question and you think it's doable because somebody in US or in Australia did it, and you start to collect data, oh, no, 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 I can't do it. I don't have the machines, I don't have the logistics, I don't have enough numbers. Like I work with the transplant, most of my research in transplant area, we're limited with, we have two types of transplantation, that like kidney and liver. A little, I think we have one case of heart transplant. Even if I want to do something on heart transplant, that's not gonna be working from the very first step. If I say like, let's see the cytokine analysis in cardiac, I only have one single case in the hospital. So usually you can know like what's your boundaries and what's your limitation, and what you can do, what you cannot do. And this actually, we call it a domino effect, the game. You know, if one fall, everything fall. But in this case, we look at this as positive. These question influence factors such as research methodology. For example, if I'm looking for people who are developing bladder cancer because they're working in a chemical factory, I'm not gonna expect to see like a lot of cases. There will be rare cases like that come to hospital. Maybe the whole year we don't see a bladder cancer. So I will know that my only way out with research design will be a case report or a case the maximum. I'm not gonna say randomized control trial because I'm gonna do that. I'm gonna go watch people in the chemical factory for years to develop cancer, and my cancer is a bladder cancer. Sometimes sample size, this is a big thing, and you know, like sample size calculation is become like mandatory now. Although there is like so many different ways to come up with like a convenient sample size, but still, even if you select the sample size, you might not get reach the time. This is the reason some now like Scape platform now, thankfully they start like collecting data from different places, multi-center, so they can solve the problem of sample size data collection. Do we have the trained personnel to do data collection? Did they understand what we are collecting? Did they understand what's important, what's not important? And also of importance is the data analysis. A lot of people actually they do all this and they get stuck with the data analysis. They don't know what to do with the data. They have a huge, humongous, big data files and they don't know what to do with this and which one should associate with. One of the studies I give the student example for all the time. Um, Somebody look at the study and he look at the length of fingers with IQ, and he find an association. Of course, this is doesn't make any sense, but this is we give it an example. So you can just correlate like column one with column B with column C and come out, even if it showed me significant. What does that mean? So we are not just like the machine. We just put data together and we give a number. We need to have interpretation. This is where the scientist is. And this a nice little tree. As you see, it has a root and it has stem. Then after that, it has branches. And this is the research process. It can branch, and you don't say like I quit. No, it will have one branch, two branch, three branch, like so many different branch. For example, we have now a project that it turns out to be three different projects because we were looking at drug-induced hematological disorders, and we find out thrombocytopenia is a completely different story than anemia, than neutropenia. So now we have three different lines of project, and we're collecting different data, different classification, and so on and so forth. Steps to developing a good research question after we finish the brainstorming, but I promise I'm gonna go to the brainstorming. So you start with a broad topic. And brainstorming, I bold it so you know this is brainstorming and concept mapping. This is very important. Collect what everybody else is thinking of the project. How are we going to do it? You can raise thought provoking questions with your friends and flesh out ideas from your discussion. This is one very simple. You can talk to your colleagues. Um, my colleagues, for example, I'm doing something in cardiology. I will go to talk to people in cardiology. I'll talk to people in cancer. If I'm doing oncology, talking to people in ICU when I'm doing stuff with the ICU, and so on and so forth. So you raise a thought-provoking question. What if I'm gonna do this, this, this? And they're gonna give you answers, and you start collecting information. Choose an area of study that you are genuinely interested in, not the thing that you like. You are genuinely interested means you have the skills, you have the knowledge, you have the tools, you understand what they are doing. You can't throw yourself into something. I'm not gonna do artificial intelligence now, and I don't know anything about artificial intelligence, so I'm not gonna put myself in there, and people will start looking at me. Oh, yeah, look at the expert. Like they know, like I'm pharmacogenetic. I can do medication safety. I'm in transplantation. I have a little bit knowledge of pharmacy practice. That's it. I'm not gonna go extract compounds from plants, and this is not my area. I have no idea. So you don't choose the area because it's hot or it's everybody's looking for, everybody's doing this. I know this is trending with all due respect, but this is not correct. And I might be wrong. Consider the interest being addressed recently by research community. You are in the research community, you should be updated. I'm not saying read every single paper published, but at least the area of interest. You can follow up the people, big people who's publishing stuff in this area. You start like knowing, oh yeah. So when we know people here now, like by their area of interest, when they told you this, they're gonna refer you to that person. So this is good. And you can, very simple, go to publication, see what's the recent publication, and be careful what publication you are looking. There is like good high impact journals. There is multi-center studies. There is like known journals, um, and you don't read anything because there is a lot of hundreds of thousands of papers that are going. So look at the papers at least who has been published in big journals, high impact factor, have citation, or they're bringing a new idea. Back to brainstorming. Why I'm mentioning this again, although I mentioned there, because this is the way that we usually do intentionally. Maybe you're gonna find out that you're already doing this without giving names. First one, the easiest, is free writing. We most of us, even if we write every day, we have deficiency in writing. Um, Start writing. Just put blank paper and a pen and start writing to yourself what do you want to do, or on your computer, of course. Like most of the people don't use paper and pen now. I'm an old style and I write a lot of stuff, so non-scientific. So you start writing whatever comes to mind until the time is up. Say, I'm gonna write for half an hour. Don't worry about spelling, grammar, or does that make sense or not. Just be free, write whatever you think. This is not easy, but trust me, if you try it between you and yourself, you're going to find out that you're going to be able to write things and you're going to find them treasure. And you're going to look, oh, did I write that? Read back over what you have written and see if anything can be used. No way, like you write a full page of ideas and you're not going to find anything that is working. You're going to cross out maybe out of 10, maybe you're going to cross out 8. This is normal. To pick 2 ideas out of 10, that's 20%. That's a great number. In ICU, that's dangerous if you say 20%. Yeah, it means one out of 5, like 30 days mortality. That's a huge number. So always start thinking of free writing as the easiest step to do. Second one, the one that I mentioned, mind mapping. Some people, they call it whipping because you're going to start like connecting dots with each other, or clustering. Yeah, just put things together. Write your main topic in a circle, a word or two is plenty. Write related terms or phrases and draw lines, start connecting them to each other. Then start to jot down as many terms or phrases you can and use lines to connect them in related terms and phrases. You never know what's from this cluster you're going to come up with. This is different than free writing because here you have the main topic and you are connecting dots. There, free writing, you are free. Journaling, this is what the scientists usually do. So this is the third level of brainstorming. And this is what, for example, we teach our students, we teach the researchers to do all the time. You would answer the following question using the information about your main topic. Who, what, when, where, why, and how. And usually I say like WH questions and I input how. And if you see how has WH, but it is reverse order. So you want to know what what's your population and what are you looking for and what's the time frame and where are you doing it? Is it in hospital or in ambulatory care or in ICU? And why you're doing it? What's the point of this? What we are looking for and how you're going to do it? This is the methodology. So journaling, it's exactly same like what the journals when they go like to people and meet them, they ask them questions like, how is the team playing? Why you think our team lost? When you think we're gonna be like recruiting a new player? Where is the next game? Who's gonna be the next player in the team? And so on and so forth. So these questions very powerful, and you cannot answer them by yes or no. Avoid yes or no questions. Uh, this is maybe a good news for people in health science, as you see, largest scientific field of study in the world are health sciences. Engineering follow, biomedical science, that's actually related to health sciences. So there's chemistry also. So there is a lot, but you want to know like health sciences is the leading. So there's a lot of competition. This is a good news and a bad news. Do preliminary review of related literature. Allow you to discover issues that are currently being discussed by scholars and fellow researchers. Up to date, not up to date the website, up to date yourself, like what is going on. Allow you to spot existing gaps. This is important. You want to know like what's missing. You don't want to do something that already people did it, or limitation of existing knowledge of your topic. Uh, you do the fine tuning. So you find the issue. Allow you to discover issues that are currently being discussed by scholars and fellow researchers. You update yourself. I write up to date actually. Oh, I was thinking not writing up to date. It's up to date. Allow you to spot existing gaps or limitation. Where are you going to find these? If you look at the any paper, when they write the discussion, toward the end they will write limitation. we did this, but we are missing that, or we did the following and we don't include this population. And you start thinking, you might come out with an idea from what the other people do. I'm sorry, somebody is calling me in the background. So I'm talking about the background information, foreground information. This is actually the way you want to do it. So at all stages, you ask both kinds of questions: background questions and foreground questions. So usually this is not bad. You just go there and look at what's in the literature. And if you want to know, like, what should I do with this data, this is usually the expert people who go to the foreground information. So usually it's essential to understand the background, because without knowing like what is going on and what has been published, what has been done, it will be very difficult to answer the foreign questions. The problem with conventional search strategies, usually either you might find too few results, too many results, or you can find irrelevant transplant. This is funny. I talk to my student all the time. I work in transplantation, and my wife, she's plant science. She's working with plants, real plants. I transplant. So when we do use the same computer, sometimes the Google history, it will show you the same history thing. So sometimes I find like topics from her area, and she might find topics from my area. So you can find a lot of relevant results in so many different regular searches. Narrow down your topic. Um this is I mentioned it before, gap spotting and problematization. So this is a way how to narrow your topic. Gap spotting: focus on the gap in existing knowledge or recent literature. If nobody is doing that, like for example, now there is a lot of new medication, they just in the market. Nobody did, for example, medication review for them. Some like for example, the um, يعني a lot of things that we might, nothing coming into my mind now because I get distracted by my phone. Um, when you read the publication, you're gonna find out they're gonna mention this is applicable to all people, for example, 18 years and above. So what about kids? Or sometimes like this drug is beneficial only in chronic kidney disease stage 3, and so on and so forth. So you start looking, oh, why these people nobody interested on, or there is a diagnostic test, a new one, but it's not really used, things like that. So you start thinking of the gaps, and this, the more you read, the more you're gonna find. So constructing research question out of identified limitation of literature and overlooked areas of studies. This is, yani, the careful reader can find this really easily. I know I'm not saying it's easy, but it will get easy with time. Researcher can choose research questions that extend or complement the finding of existing literature. I'm not saying all the time come up with something new. It's the best if you come with something doable but new. But also you can something already they did it. For example, I'm giving you like very recent example that we submit. COPD exacerbation, they give antibiotic prophylaxis in the guidelines. They said give azithromycin. When we got to the literature, they will tell you give azithromycin 250 milligram once daily continuously for a year, or give 500 milligram every other day in the week. So which one is preferred? So now we come out with something like we have two different things and they don't have evidence for that. So now we are designing a pharmacokinetic study to see if the once daily 250 is better than 500, or the 500 is better. Problematization aims to challenge and scrutinize assumptions that support others and the researcher's theoretical position. So somebody come out with something, and you find from your clinical experience or from your practice that this is not quite right. Okay, so you can suggest something new. I don't want to use this. Let's see. We already published like recently a paper for use of albumin in sepsis, and we find out like some people they are. I know like we don't give albumin to people in septicemia, but there is a lot of places they just give it indiscriminately, same like the other IV fluids. So we find out there is no benefit. So you can challenge the people, depend on your like area of expertise, of course. The last one, I put it the last because the last is the most important one. Researcher personal experience. Researchers who are also practitioners can reflect on problematic areas of the practice. They are the one who's telling us, oh, I have this problem. How about looking at this? Let's see. So the researchers and the practitioners and the who is the has the dual status is the greatest. Patterns and trends in practice may also provide new insight and potential research question example. I see before one in the dialysis, somebody told me, oh no, we are using erythrocyte stimulating agent to almost every patient. So we go design a study to see like, does everybody qualify to get, because there is guidelines, there's protocols, and there is stuff like that. And we find out the problem, it is not exactly like he described. So we come out with a big number and see the practice and see what's happening. Evaluate the soundness of your research question. The acronym for that is FINER. FINER is visible, interesting, novel, ethical, and relevant. Visible means the question is well within the researcher ability to investigate. If I can do a retrospective study, I will do it. If I cannot do clinical trial phase one, I'm not going to suggest something like that. So you should be realistic. You know what you have. But sometimes also you can collaborate with other people who do stuff. Interesting, not only to the researcher. And it should be also when the people, oh yeah, you're doing that. Oh, that's really great. We like when we publish some papers, we find like a lot of citation come to us, and there's some papers never been cited. So it was interesting to me at the time, but it's not interesting to anybody that nobody cite. Novel should be developed to bring new insight to the field and the study you are investigating. Of course, novelty means nobody did this before, or only few people did that. Ethical, of course, this is not even an option. We have to be ethical when we do studies, and you should know that you gonna abide to the laws and the regulation and all these with authorities. So when you submit a project that is ethical, so this is the only way to go through. If it is has issues or questionable ethics, you're not gonna finish it. Relevant should be relevant to scientific community and people involved in your area of study. Like I would love somebody in IC when I told him I'm doing like investigation about plasma. Oh yeah, this is new. We get it into the pulmonary. Da, 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 da. So you start like thinking, oh yeah, so somebody's gonna read my paper. It's not gonna be a zero citation anymore. Construct your research question. I'm sure you know all of you this, but I will give it in this perspective. I know most of the pharmacy people in the university and medicine they study BICO approach. Now it is modified to become BICOT. They add fifth item. It's BICOT approach. B, as you know, patient, population, problem. So what's your primary problem, disease, coexisting condition? What group do you want the information? How would you describe a group of patient? Sometimes age or sex of a patient may be relevant. For example, like postmenopausal woman with hypertension. I identify my population. I can't say woman. I can't say maybe postmenopausal it has to be woman. But here I make it specific with hypertension. Intervention. What is the medical event you want to study the effect of? Is it medication? Is it a fluid? Is it a surgery? Which main intervention are you considering? Prescribing a drug or doing a test or doing a surgery? For example, here in this case, they give estrogen replacement. Comparison. This is really important and it is easily missed. You want to compare to something. If you want to say my drug is better than what? Nothing? You have to have a nothing group, what we call placebo group. Or some people they do non-inferiority versus a standard of care. Some people, they will compare several interventions at the or different doses. What is the main alternative to compare with the alternative? In order to tell me, sometimes there will be no comparison like surgical intervention. So, but usually comparison will lead you also, will make your life easier when you want to do statistics. Outcome, what's the effect of the intervention? You can't just leave. I compare this with that in terms of what? Side effect, safety, a combination, what? And what do you hope to accomplish? What do you want to measure? What do you want to improve? What's the effect of this intervention? For example, in this case, they give estrogen replacement therapy to most menopausal women with hypertension to improve their quality of life. Time, this is the additional one. This is important in research. Same like money. Time is money, but money is time in this time. What is the time frame for your research? When the research will be executed? For how long? What's your research group? Is it 18 to 65 or is it 65 and above or is it pediatric? When you do measure or evaluate the effect of intervention. This is an example. Question: between the age of 5 and 18, are children of parents with diagnosed mental health issues are increased risk of depression, of anxiety compared with children of parents with no diagnosed mental health issues. So your population is children. Intervention, parents with diagnosed, actually it's an indicator here. Parents with diagnosed mental health. Comparison group, children of parents with no diagnosed mental health. The outcome, increased risk of depression or anxiety. Time frame, between age of 5 and 18. So this is very easy. Sometimes you might need some help from the people who study design and to identify your population. Sometimes you might change your population. But this, you're going to change everything if so. This is the reason we did this after the brainstorming, the focused question. So you define this. If you start with this, that will be very difficult. Here, these are the evidence-based medicine types of questions: intervention, etiology, and I know you know all these, but for the completion purpose, I put it can be diagnosis, prognosis, prediction, frequency, and rate. This is very common at our, because we do frequency, rate, prevalence, and incidence. We phenomena or thoughts. This is less, but a lot of people they do general issues like, for example, obesity or depression or something like that. If you want like to go into the deep blue sea. Uh, Examples of good and bad research question. I'm trying to finish like at 1 hour completely. So example of good and bad research question. Bad, how does social media affect people behavior? This is a question come to our mind all the time. But good, if you ask this question, what effect does the daily use of YouTube have on attention span of children aged and under 16? See, you define your population, children aged under 16. The problem, attention span. The intervention is YouTube, daily use of YouTube. Look at that. And what's the outcome? Attention span. So now you know the very one, why it's bad, vagueness of social media. What's in social media? You can say I'm using social media. That's vague word because there's so many different social media platforms. And the question, lack of specificity, affect people behavior. Whose people? Which? Old people, young people, children. So when we put the good question, we have defined. Another question, has there been an increase in childhood obesity in KSA in the past 10 years? This is a concern. Everybody is thinking, oh yeah, everybody is getting bigger. Maybe this is just somebody noticed around him, his kids, his neighbors. We can put a question different, like maybe more educational. How have school intervention programs and parental education level affect the rate of childhood obesity among first to sixth grade students? Look at that, almost the same. But we identify our population, we make it focused, and we see what is the factors that is changing the rate of childhood obesity. We still can do the first one, but it will be like very lengthy and very random. So research question is not ideal because it's too simple and it's easily answerable by yes or no. If somebody has been an increase in childhood, somebody say no. You're doomed, done. Common mistakes. Refrain from committing the most two common mistakes in framing research question. Posing a question as anticipated contribution. What will exist or be known when you are done. So You already know like what's happening. So you are executing the research question, and you know what's the answer, and you know like people will adopt pharmacogenetic testing. So why you're doing it? I don't know what's the motive behind that. Or framing a question as a method. This is usually debatable because some people they think like the question of methodology is not acceptable. In clinical research, we try to avoid uh, that thing. But these are the common mistakes. Finally, the take home message. I'm sorry, I will be exceeding maybe 1 minute. Research question is a dynamic process that involves continuously updating one's knowledge on the topic and refining ideas at all stages. Doesn't mean if you put a question, you brainstorm, you end up with a question, you're done. No, maybe something emerging. Some research take few years to finish. Remain updated on current trend, research studies, and technology. You don't want to like propose something that it's really old, or a drug that is, for example, medication that is outdated, or it's not even in the formulary anymore. Nobody will be interested in that. So start looking like what's trending, what's new. Make the research question as specific and concise as possible. And I stress on that. And you know, like now, how it will be specific. Seek the input of experts in the field, mentors, and colleagues all the time. I know, like we have this like competition. It's a nice competition, but usually, why you don't ask people? Maybe they will have the answer that it will take you 3 days, a few days to find out the answer. Ask the experts around you. Ask people for help. Find a mentor. Talk to colleagues. Present in the conferences and listen to them. And I think that's the whole thing. I hope you enjoy it.